Hey everyone, I'm so excited to make this video today and partner and collaborate with Neo Cardio Lab and my good friend Gabriel. Today I wanted to go through a normal heart to demonstrate normal cardiac anatomy. And the heart would sit in the chest like this. So anterior surface would be coming out towards the screen, the posterior surface towards the turntable, left would be here, right would be over here, head or superior would be here, and legs or inferior would be down here. Right? And usually what I like to do is start off by finding the right atrial appendage, which this is the right atrial appendage here. And you'll see that it's triangular, broad-based, or pyramidal in shape. So why don't we go ahead and open up the heart from there. And when we open up the heart, here we find that there's pectinate muscles that spill outside the confines of the appendage itself, which is consistent with a morphologic right atrium. And then here, we find this circular structure here, which is the oval fossa. And obviously, clinically, this is where we often find atrial septal defects or patency of the oval fossa itself. So here is the oval fossa. And then as we look elsewhere in the right atrium, we find the mouth of the coronary sinus. And in this heart, it's tucked back here. And this is where the coronary sinus drains into the right atrium. And this structure right here that I'm pulling up on is the Thebesian valve, which guards the orifice or the mouth of the coronary sinus, which is right back here. Right? So I'll put the heart back down like this. And here is the right atrium. Here are the pectinate muscles. Here's the oval fossa. And then here's the mouth of the coronary sinus. And then, of course, we see that there is a right-sided atrioventricular junction here. There's a valve that is guarding it that appears to have 3 leaflets, 1, 2, and then 1 here. And not only does it have 3 leaflets, but one of the leaflets is directly connected to the ventricular septum. You can see these connections right here. So this is consistent with a morphologic tricuspid valve. And this ventricle here has very coarse trabeculations. It has what we call the septomarginal trabeculation, or the moderator band. This is an important structure as there are some electrical components to it. And it's also a structure that we can see by echo as well. And this is a defining feature of the right ventricle. So between the coarse trabeculations and the presence of a septomarginal trabeculation, this is in fact a morphologic right ventricle. So then we get to the outflow tract here, and we see that in fact there is an arterial valve here, or a semilunar valve. This one has 3 leaflets, 1, 2, and 3, and 3 distinct sinuses. Within the sinuses, we don't see any coronary arteries arising from them, all consistent with a morphologic pulmonary valve. And you can see that the pulmonary valve is completely supported by muscle here. What I do want to point out is that what we kind of believe to be an annulus as a round or oval structure is actually not a true structure. The arterial valves, or the semilunar valves, are actually kind of crown-shaped in their annulus because the fibrous leaflets of the valve itself have triangles of myocardium interposed in them. So what we call the annulus as an oval or kind of round shape is actually just a man-made construct. It's helpful clinically, but that's not its true annulus. Here's the pulmonary trunk. It's been transected. So why don't we flip over this heart and look at it from its posterior aspect. Here is the left atrial appendage, kind of a cute little structure. Definitely much smaller than the right atrial appendage. And now when we open up the posterior aspect of the heart, we find another atrium that's pretty smooth-walled, and that's consistent with a morphologic left atrium. And here is the opening or the entrance to the left atrial appendage. And we can see that none of the pectinate muscles of the left appendage actually spill out into the atrium, consistent with the morphologic left atrium once again. We see that the left atrioventricular junction is guarded by a valve that has 2 leaflets, 1 and 2, and that this valve doesn't have any connections to the ventricular septum. Right? So here's the ventricular septum, here's that valve, there's no direct connections, and this is all consistent with a morphologic mitral valve. Now, this valve opens up into a ventricle that's pretty smooth-walled, consistent with a morphologic left ventricle. Here's that anterior leaflet of the mitral valve again. Then we open up into the left ventricular outflow tract here, and we find another arterial or semilunar valve. This one has 3 leaflets, once again, 1, 2, 3, with 3 distinct sinuses. And we can actually see a coronary artery arising from this sinus right here, so consistent with an aortic valve. And we already see the ascending aorta, the transverse arch, and the descending aorta here with the head and neck vessels. So we know that this is going to be the aorta. This is the aortic valve. And important to once again demonstrate that, in fact, the arterial valves or the semilunar valves aren't actually truly with a round or oval annulus. They actually have a crown-shaped or semilunar annulus. And what's different about the aortic valve from the pulmonary valve is that usually there's fibrous continuity between the aortic valve and the mitral valve, which we see right here. So the aortic valve is not, in fact, supported entirely by muscle. Part of it is, and that's this part right here, but then part of it is actually supported by this fibrous continuity with the mitral valve. So that is a normal heart, and this would be a neonate to small infant.